Welcome to the Flower Lounge, a place for conversations with wildly creative people and a little plant-loving wisdom to help you experience life in full bloom. I'm Katie Hess, flower alchemist and founder of LOTUSWEI, and I believe in a world where we're all living at our personal edge. Welcome to this week's episode of the Flower Lounge. I'm really excited to have this week's guest. He is a celebrity by right in the world of herbalism. I have seen his name pop up for many, many years in my studies of plants and flowers. And we have with us Seven Song. He's a clinical herbalist, teacher, botanist, and naturalist. He's the director and main instructor of the Northeast School of Botanical Medicine. And he's founder and practicing herbalist of, this is so cool, the Ithaca Free Clinic, an integrative clinic providing free consultations and herbal medicine. And as a clinical herbalist, he practices an integrative approach, working alongside conventional and holistic practitioners to provide multiple healthcare avenues for people's needs. And he aspires to make herbal medicine accessible, affordable, and within the reach of everyone. Some of his goals as a teacher to help students learn accurate plant identification and environmental awareness while gathering plants for medicine. He also teaches clinical and counseling skills and how herbal medicine can offer primary and adjunct treatments for acute and chronic health conditions. Seven Song has been active in, and I can't wait to talk about this, herbal first aid for many years, working at clinics, first aid stations, and as a street medic. If you look on his Instagram page, you can see some of the various events that he's offered up his services for. He's helped run the first aid station at the Rainbow Gathering for over 25 years, which is an off-the-grid first aid station that many people visit daily with a wide range of health conditions. One of Seven Song's herbal medicine passions is traveling, gathering, and preparing the herbal medicines that he uses in his practice. And he also teaches at a number of herb schools and conferences in the US and abroad. And you can look for him in various habitats, taking photographs of things that run, crawl, fly, or photosynthesize. So as you're listening, if you want to check out more about Seven Song, his website, I'm just going to throw this out there right now, is the number 7 and then song.com. And you can also find him on Facebook and Instagram. Thank you so much for being with us.
My pleasure, Katie.
So we usually start out with this really simple exercise where we just ask you to close your eyes.
Oh, not again.
Not again. Or you can keep them open if you can go back in your memory to a time when you were a child and you played around flowers or plants. And just curious about who you were with, what you were up to, and what might have been your favorite flower or botanical from childhood, whatever's jumping into your mind. And then if you can reflect on the 3 words you would use to describe its personality. When you got that, then...
I would much rather go like it's 3 chemical constituents.
Okay, we're going to
physiological mechanisms that it's oriented.
Awesome. Well, this is great. So from right out of the gate, we're pushing you out of your comfort zone. This is a good thing. So maybe just share with us what you were up to, what your favorite was, and the 3 words you would use to describe its personality.
So as a child, like a younger child, herpetology was my first science. Well, my first was astronomy. And then as a young child, it was herpetology, which is the study of reptiles and amphibians. And plants came much later. So I've always had a wide-ranging interest in the natural world. But as a teenager, me and some of my friends, I'm 60, so this was probably 1972, 73. We went out and I gathered some sassafras roots. So I think the first plant I ever gathered purposefully was sassafras. And my friend had probably like a 68 Cougar. So if anybody out there knows your muscle car, 68 Cougar, incredibly uncomfortable, like very like built like with trim and very stylish. But anybody in the backseat, especially if you're a little taller, I'm a little over 6 foot, like your knees are in your mouth. So it's funny. So if I would say my correlation with sassafras, I think teenagehood, not particularly good. I would say plants suffering in the trunk of a car, and the aroma. But the aroma, because it's the first time I gathered a plant and smelled it, because it's the only way I knew it. Botany was about 6 years later, I'd start to study how to accurately identify plants. So sassafras is mixed in with a kind of a mixed up teenagehood, which I'm sure many people can relate to. And people of my age are also, right now, you're thinking of Chevys, maybe the Nova, and other muscle cars of the era.
Okay. Let's dial in here. When you think of the aroma, how does it make you feel?
These are going to be difficult questions. I'm not sure you're pushing me out of my comfort zone. It's like I have a deductive mind. So how does it make me feel? If I wanted to gather the plant and I felt like it would be good medicine for somebody, then it makes me feel great. Like I'm thinking, oh, here's some sassafras. But actually, I don't use sassafras very much medicinally.
Right.
So mostly I use it to smell it, to make some tea with it. Also, if anybody's ever chewed, so for me, a lot of sassafras is texture. If you chew sassafras leaves, they're very demulcent. I mean, they're a part of filet gumbo. They're the part that makes filet gumbo thick. And so I think of sassafras texturally as demulcent or mucus making, which is really nice when you're hot outside, you chew it. And I do. I find the aroma delightful. It has a root beery smell, and root beer is one of my favorite drinks.
Mm.
So, Katie, I just want to make sure everybody knows out there, because often people, for some odd reasons, think that I'm Native American, maybe
Sure.
my name, maybe my hair. So I'm a Russian Jew.
Uh-huh.
Well, I don't know how many generations, 5,000 generations, 3 generations, long line of Russian Jews. And I definitely practice a form of medical herbalism.
Yes.
So not medical in a very stringent sense, but medical in where I think of things in medicalized terms. So right before I came on here, one of my neighbors had taken a bad fall, and he came in. I was really nervous because his head was bandaged up, like he was wearing an old swimmer's cap.
Wow.
But that was bandages. But he just wanted to talk about inflammation on his forehead. And so he was worried about, he wasn't sure what he's worried about. I was worried about cerebral inflammation, very big problem, but mostly was just inflammation. So this is the kind of service that I want to help people with, very direct. So you want to know, should you go back to the hospital or go to the free clinic?
Yep.
He also looks terrible. I mean, he's swollen around the eyes.
Oof.
So kind of very much, but this is the kind of thing that I see fairly regularly, and I feel fairly comfortable, because at this point in my life, I often understand what needs to be seen, what's an emergency. Because once you know what's an emergency, it's just like once you know what all the poisonous plants, everything else is a little safer.
Right. You know how to take action.
Right. And then just to add a little bit, that I'll come back, as I told you, I'm very nonlinear. And then the thing that I told him, which was really true, is that I'm not an expert. I never went to medical school. So I have a lot of experience. So if he's worried, he needs to see a medical expert. And there's no FDA breathing down my throat. I just want him to be alive, right, and healthy.
Right.
So those are all important parts of me. Back to you.
So what we find is the way that you describe your childhood favorite, or teenage favorite in this case, would describe the way that you bring your qualities or your talents into this world. So you said demulcent. I could interpret that as soothing.
I would interpret it.
Or how would you interpret it?
Well, many things are, I would say, soothing with a honey-like consistency.
Woo!
Because many things are soothing, or if you want a snot consistency, but a nice runny snot, like a snot that's not like a booger that you can't get out, or a booger that's coming out on its own, like medium booger.
Okay, so I'm going to say that you're soothing with a honey-like consistency. You're funny as hell, and you're delightful.
Thank you. And you laugh at my joke, so thank you.
Wow, that's so great. So I imagine that's the qualities when you're seeing somebody who comes in with an issue and you're having to take action in terms of first aid. You're providing humor, and you're soothing, and you're delightful. And you said honey has a million amazing properties. So let's just segue that into first aid then. I think that this is a topic that most of the average listeners will not have any experience with. And by the way, I poured over your website, and I was so inspired by your first aid backpack. Holy crap. Okay, if anybody's listening, go to sevensong.com and check out the blog post on his first aid backpack. It is incredible. I want to make a backpack like this with flower essences. It's nuts. How many bottles do you put in there?
Well, the whole thing, I'm not really sure. I'm actually redoing it right now. It's about 15 years old and just falling. I mean, like anything that gets used, I'm amazed it lasted this long. But maybe 25 bottles. When it's full, it weighs about 22 pounds. So
Whoa.
it's not that heavy. And I'm not. I don't. I mean, I walk fast. I hardly ever run with anything. Running's a great way to hurt yourself.
So maybe tell us a little bit about the plant allies that you have in your backpack that you use in first aid. And then maybe from there, we can talk about, like what the average person at home could stock up with, because your backpack is way more sophisticated and elegant than what I would rely on.
So the backpack is pretty much made for things that work acutely.
Okay.
So I have a lot of herbs in there. Let's say something like, I might use a plant like redroot, ceanothus, for long-term infections. But it doesn't do much quickly, at least that's my perspective of it. And so that wouldn't be in there. So almost every herb in there will have an acute response or have a quick response or a long-lasting but coming on soon response. So a lot of things for infection. So the things that often I see are either bacteria infections like E. coli or staph or strep, viral infections like noroviruses or respiratory viruses, colds and flus, occasionally parasites like amoebas or giardia, though less so. So those are the main ones. I mean, there's some stuff in there for fungal infections, but they take a long time. So often if I'm in a first aid situation and somebody has a tinea or another fungus, we talk about how to have where to go. Often, so I'm going to jump out. I'll try to jump back. If not, please remind me.
Yeah.
So a lot of the people I work with have a lower socioeconomic status. They've often not had healthcare when they're young, which means things just pile on as you get older. So a lot of what I'm trying to do is how to help people access resources. Later, we'll talk about the free clinic here, but it's too bad there are not thousands or hundreds of those all over. So if somebody has something like a tooth infection, I might be able to diminish the pain and inflammation, but the tooth might have to come out or something else might have to happen. Dental care in particular is a problem, right? Because it is, even if you're insured, it's easy, a couple of $1,000s to have, unless they extract the tooth, which is what most dental vans will do, because it's inexpensive for them, free. So that's a lot of it is working on access for people. And then a lot of the other stuff, a lot of pain remedies. And so there's both emotional pain and then there's physical pain. And then there's a crossover. But when people hurt themselves, often they have a sense of trauma, right? A dog bit them, they just sprained their ankle, and it ruins your day, right? I mean, it's just a reality. Like I said, here you are, have your backpack on, you're hiking at this place, like all these things you're going to do, and then you put your foot in the divot, and it twists, and like you hear the sound, and right? And so then, so also you're like, damn, or other people start crying, or other people get spacey. I mean, there's different emotions that happen when things go wrong. And so a lot of herbs just try to help support the person if they want that. I mean, I am pro-emotion. I might not have many, but I'm totally pro-emotion. And so, but sometimes they do. And then there's just the physical pain. And so how do we numb it? And then with physical pain, do you want sedation or non-sedation? Like if you sedate, it's easier to reduce pain, but then you're less cognizant. So a lot of stuff for pain, a lot of stuff a few herbs that will alter adaptive and innate immunity, so that I can get people's immune systems boosted up to help after an infection. A lot of external applications for sprains, soft tissue injuries, tooth injuries, burns, diarrhea all the time. So those are some of the things. Right now, I'm getting ready to go to the Rainbow Gathering, and I have been one of the main people there for 30 years. And I just have to say, most of the Rainbow Gathering, I don't really care for very much. Like you read my Burning Man thing, but I love about the Rainbow Gathering as it's in the woods. And it's very interesting practicing off the grid. So like wash water, I mean, you have to stay clean. Like you have to wear gloves, you have to stay clean, you have to.
Wow.
So there's that. And the past 4 or 5 years, we've just had a great staff. And so for a number of years, I was kind of by myself a lot and without a lot of input. And I definitely am limited in my knowledge. And lately we've had an emergency room doctor and an amazing paramedic.
Wow.
And so that covers a lot of the physical stuff.
And how many people come to these Rainbow Gatherings?
So it started in 1972. And so it's just mostly word of mouth. It's free. So the thing about the rainbow gathering that I do like is that it's very socioeconomically open. It's very, there's no money. There's also there's no bands, right? There's lots of people playing music often. And I was just going to make fun of drumming, but I'll jump out of that. So anybody can come, and actually they would get fed, right? So the food might not be great, but you will get fed. So a lot of the people there have had long-term health issues. I have worked at other events that cost money, and it just changes the status. Unfortunately, it's not a very diverse group. I would say 75% Caucasian, European.
Mm-hmm.
So it'd be nice if that was more diversified, maybe even 80%. But socioeconomically, again, to use that word, very diverse. And I like reaching out to people that don't have access.
I think that's very interesting that and very kind and generous, that you offer your time in a situation that you don't fully agree with what's going on. Like I read your post on Burning Man. It's hilarious. So for the listeners, his post is titled something like, and I hope I don't butcher this, but it's like, why I went to Burning Man so that you never have to. It's hilarious. It's so funny. And, so you offered you really did your damnedest to offer what you could there. And you've been offering your services at the Rainbow Gathering. I think that's an incredible generosity, especially since you don't agree with everything that they're, other people might just say, I'm not interested, and turn their backs, but you really care about people.
That might be a bold statement. I really, I do care about people. That would be correct. So just the input. So I don't really believe in altruism, right? I think some people like to think that they're altruistic and give for free. I think that we are animals, and animals do things to fulfill their biological necessities. So I'm not a mater, so I'm not looking for mates. But I do think that we do things because they feed us somehow.
How do you get fed?
I like helping people, and here comes the trick in the middle of the whole thing. Okay. I want to know if herbal medicine works. I want to know, do these things, because lots of things get passed historically that are terrible. We could just think of misogyny, right? We have like centuries of misogyny in the world. And we're like, oh, it's an old tradition. Let's just keep misogyny going. Like the Me Too movement is busting that apart, and it's about time. And then people come, all the reasons that things make change. The reason I'm saying it is because sometimes people will say, well, herbal medicine has been practiced a long time, so it must be good. There is a reality that part of that is true, right? There's no way, if everybody died, we wouldn't be an animal with non-altruistic feelings. So there is historical record. Human beings can be very smart and write stuff down and pass stuff off in stories that is very accurate. But it doesn't mean the whole encyclopedia of herbal medicine is accurate. Right. And so I want to know, like, how well herbs work. So I get to practice first aid. So I want to say that I really do care about people. Like when I'm there and I'm, awake and focused, I really do. I like helping people. It's incredibly feels great. I mean,
and you're a researcher. You're doing research.
Yeah, and practice.
Right.
So, but there is some amount. I mean, some things are not research. Like I've been treating staph infections for years. And so maybe not so much research there and just treatment orientation. Mm-hmm. And then in the free clinic, I treat people who have chronic healthcare problems, right? Because you have to make an appointment to come to the clinic. It might take a couple of weeks to see me. Right. It's free. And so there I'm working that. So I do like to help people. That's true. And I also want to figure out what's true in herbal medicine with doing the least amount of harm and the most amount of good.
That's great. So what are some of the chronic conditions that you see in your free clinic? You talked a little bit about the acute that you see. What's going on chronically?
Anxiety. So it's hard to know if we've always had anxiety or if we actually have so many, like we don't get eaten by large animals. Very few people in the United States will starve to death. Malnutrition is common, but not starving to death. And so I wonder sometimes if that allows us to actually feel the anxiety that we have. But I would say 40, 50, 60% of the patients feel anxiety on a regular level.
Wow.
That inhibits their ability. Well, so everything is select, right? I'm an herbalist and herbs are known to help with it. So, but a lot of people, anxiousness, I'm ready.
Quick question for you. How many years have you been at this?
12.
Okay. 12? Yeah. So let's say when you first started seeing people at the free clinic 12 years ago, did you see this many anxiety cases or has it grown over time?
It's a hard question because I see more and more patients.
Mm-hmm.
I'm not really sure. I don't think there's an exponential growth. I think that even with like having like people like Mike Pence who wants to do away with Planned Parenthood, which is just stupid. It just annoys me a lot. So everybody political here, I mean, I'm just a pro Planned Parenthood. It's an amazing organization. Anybody wanting to take that away is just like has something wrong with them. So, or attitude problem. I guess what I was saying though, before going political, is even with the new administration, which does make a lot of people anxious, taking away, if I work, because I work with I work with a lot of people who are new to the United States and have come here from other countries and their status is threatened. So maybe there's more anxiety, but it seems like there's always been, I guess what I'm trying to say is, it seems like it's always been there.
Okay.
And then some people help give voice to it.
What about Lyme's? Do you see any Lyme's cases?
Oh yeah, a lot. So we have a lot of Lyme here. I'm in Ithaca, New York. Ithaca has medium amount of Lyme, but since people come from a wider region, there's a fair amount of Lyme and Lyme-like symptoms with no positive tests. So hard to know if it's Lyme or not, but it clearly has something. The symptoms are very common. So yes.
Okay, so can I pick your brain then?
Sure.
In terms of first aid.
You mean like an ice pick and just go in there?
Yeah. Okay, so somebody burns themselves on the stove. It's a pretty bad burn. What do you recommend?
Well, do you mean like a third-degree burn? Because then I recommend a hospital.
No, I mean like, some you hit the side of a pan or the oil spreads out and you put it under cold water and ice. You're going to recommend like lavender or honey or?
Well, those sounds like you have sounds like you know a lot. So yeah, so cold ice, I mean, ice that's wrapped in a cloth, right? Because you don't want to put ice directly on a burn because that could do a little damage. And you have to be careful with water that it's not coming out too hard. But really good is an ice pack in a light towel and putting that on because you have to cool it down. The quicker you cool it down, you reduce the damage. The longer it's hot, the more damage accumulates. And then a lot of things that you said are great. So if it's a very small spot, like a grease splatter, then lavender essential oil directly on the area is good. If it's a larger area, then getting lavender essential oil, putting it in a spritzer bottle and then spritzing it is helpful. As you said, honey is one of the best. I actually didn't start using it till last year.
Really?
Yeah, really.
Cool.
There's lots of other plants.
Yeah.
I just made the jump, and honey is great. There's one problem, though, that I don't know if people think about much. So if you're in the wilderness and you put honey on people, you attract insects.
Right.
So you have to keep it really well covered. Otherwise,
ants crawling up your arm.
Yes, exactly. You fall asleep and you wake up with covered. Also, it gets dirty. But otherwise, it's very inexpensive and quite useful. And medically, they've actually did some studies, something like honey versus silverdene, the antibiotic cream put on, and actually honey did just as well in most places and better in some.
Wow.
Yeah. And
would you just apply that straight? So you're just like smearing on the honey and then putting a gauze over the top?
Exactly. So getting a raw, it can be filtered, but it has to be raw. It can't be heated. Heated just makes it less strong, I think. Actually, I haven't read any studies. Anyway, I get some raw honey. We put that on, then some gauze on top, and then roll gauze on top of that. And if it's like on an arm, then we use what's called a tube bandage and put that on so it holds it in place. You want to avoid tape. Tape on the skin just doesn't feel good.
Yeah.
So sometimes you have to use tape. Like any people like get infections on their butt cheeks, you can't wrap, right? So you have to tape.
No butt wraps.
No, but if you want to, that seems like a whole hair wrapped, butt wrap. If people want to see a bandage on a butt, though, you can also go to my website. Last year we had somebody had a staph infection on their butt cheek.
Wow. What about diarrhea? I feel like that's just so common. We eat something out at a restaurant, we get diarrhea, or kids get diarrhea, or we get food poisoning. What do you recommend for that?
Well, so diarrhea is a symptom. I don't know if you've ever thought about it. Do it right now. Chop the word diarrhea in half. Diarrhea.
Oh my goodness. I never thought of it that way.
So the rear is in dire straits. So diarrhea is a symptom. So diarrhea could be food triggers, it could be anxiety, it could be infection. And with infection, it could be protozoal, bacterial, or viral. And it It could just be idiosyncratic. It could be IBS, ulcerative colitis. So with diarrhea, it's imperative to try to figure out, initially at least, is it infectious? Because if it's not infectious, then you don't want to give things like Oregon grapefruit or Japara amargosa. You want to do stuff that, like, because those are not going to help if it's triggered. That's going to help it. Not often.
How do you know if it's infectious?
That's my Long Island thing. Often. With a cup of coffee at the mall. So often, if you're in a communal environment, meaning many people, you look for groups of people having diarrhea. Because, like, if you're allergic to gluten, you might get diarrhea, and maybe one other person, but not everybody, right? So if I'm working at the Rainbow Gathering, so in 1 week when I'm there, and I see 7 or 8 or 10 or 20 people with diarrhea with similar quick onset, for instance, I would think that there's something going around. I won't be able to separate it, though, initially from bacterial to viral.
Okay.
But some herbs do both. So if you were at home and you got it, I just really wouldn't know what it is.
So if you live in a house with lots of people, you have a big family, and suddenly everybody gets diarrhea.
You would assume it's something that you're assuming that somebody left the hummus out too long.
So in that case, what would you recommend? I had a really bad case of, I don't know, I think it was food poisoning, where I was just like hot and cold, chills, fever, flashes, laying on the bathroom floor. Like,
that sounds viral.
Really? And where it's, coming out from the top and the bottom, and the body is like trying to expel as quickly as possible. You would say viral.
Our bodies react more feverishly to viruses than bacterial, but often it doesn't matter. Well, it matters a little bit, and here's why.
Okay.
So the remedy that I would recommend, the inexpensive, it's not herbal, the inexpensive remedy I would recommend for everybody is having a bulk, like some powdered activated charcoal.
Yes. Oh, I love that stuff.
Activated charcoal is really, so it's inexpensive. If you buy it online in bulk, it could be like just a couple of bucks. Well, it's about $60 for 4 pounds with shipping where I get it from. And so you can't see my hands, but probably like 8 inches. It's like a small bucket worth. So you can get a much smaller amount for like $10 or $15. You can have enough to cover a lot of family needs.
So do you fill your own capsules, or do you?
No, I don't. You do it directly because it's much easier and less expensive. And so, but the thing about activated charcoal that's important to realize, it only works with stuff it comes in direct contact with. So it's only going to work for bacterial infection, non-viral, because viruses are deeper in your cells and they'll do nothing. It won't hurt you, but it won't do anything. If it's bacterial, bacteria release endotoxins into the intestine, and so you start to absorb some of those. So, but I would suggest if people want to do a tiny bit of research, find out what an adsorbent is. So absorbents are like sponges and gauze pads. Adsorbent with an AD is what activated charcoal is, and it makes a much tighter bond. It's a whole other chemical process of grabbing something and holding it.
And then pulling it out, right?
Just keeping it local and making a tight bond, so that when you have a bowel movement,
right,
the activated charcoal is still holding on to those endotoxins or whatever it's trapped on. I'll spend too much time, but I would suggest that people read a non-polarized article. So it's neither great for everything nor bad. Okay. It's somewhere in the middle. But for bacterial infections are really good. And the beauty of it is, if it's the wrong thing, you just poop it out. But the thing to know is your poop will be black. And for a lot of people, if you look at your poop and your poop is black, it's scary, especially if you know that's the color of internal bleeding. It's just because all of it comes out, we don't absorb it.
So okay, because I've only ever taken it in a capsule. So you're actually taking spoonfuls and stirring it into water and drinking it?
So about 1 full teaspoon for an adult. So an adult our size, 1 full teaspoon, put into a glass of water, stir and drink. And the activated charcoal makes very weak bonds with water. That's why it works. Otherwise, we just bond with the water and come out of you with water bonded to it. But it'll bond to other proteins preferentially.
So what if you're feverish and you think it's a viral infection?
Then the activated charcoal will do nothing. And so if somebody has, well, you have to who are they? How healthy are they? Are they an elderly person on many medications? But let's just go with a reasonably average healthy person of any age. I would probably give them a couple of herbs. So I'd probably give them echinacea to stimulate both adaptive and innate immunity. So I'm a big echinacea fan. And I would probably start with a dose of about 2 milliliters. So that's 1 full dropper of a 1 ounce or 2 ounce bottle, 2 milliliters, one full dropper of a 1 or 2 ounce bottle. I'd probably give another 1 milliliter, half a dropper full of Oregon grapefruit or any kind of plant in the genus Berberis, because it's more direct at killing stuff. I would give some yarrow, which seems to have some direct antiviral properties. And don't mix them with the activated charcoal, because activated charcoal will preferentially bond to the tincture, thereby wasting your medicine all over the place.
Right.
Maybe some bone set, though bone set might be problematic as I'm learning about it currently. It might be rich in these chemicals called PAs, and then we'll have to stop using it, unfortunately. Then I'd probably, maybe if the person didn't have high blood pressure, some licorice as an anti-inflammatory. Then you can also use licorice powder and stir that into water and add things. So maybe you have like 2 to 3 milliliters of all these things together, all the liquid, in some licorice root powder.
One of the herbs that I always loved for trauma or shock, just like I find an animal that's gotten hurt, or somebody in a car accident, or I myself have gotten into like little, mini, not actually collision, but like spinning around in the car, and I'll put some cayenne under my tongue. Is that something that you use for shock at all in your practice, or not so much?
I don't really work a lot. So like for me, shock is it's when the cardiovascular system relaxes and blood moves out into the tissue. And cayenne, I heard, is actually quite good for that, but I haven't, so I don't do that. If you're talking like shock where you have like something that's has changed your perception, you feel really out of it, I haven't used cayenne that way, but I do use herbs a lot. It's the whole trauma thing.
Right. What would you use? If somebody comes to you and say they got a trauma to their body and they just seem sort of spacey and out of it.
If they seem spacey and out of it, maybe something like tulsi and rose.
Wow.
Would be really nice in glycerites or tinctures. So if they seem panicky, anemone or motherwort, this is good. Thank you. Otherwise, it sounds like I just sent everybody to the hospital, right? in the first aid, the reality checks are very strong, right? Because people can die. It's not like they have a really bad cold. You give them echinacea, and who knows if it helped, but they're going to be better in 4 or 5 days or 3 and 4 days, right? So, but I would say if people are panicky, anemone is one of my favorite plants also. It's called pulsatilla as well, or pulsatilla, and motherwort. Sometimes lobelia for people who are panicky. With people who are spacey, sometimes calamus is really nice.
Wait. Hold up. Okay, so lobelia. I've only ever taken 1 drop because I feel like if you take more than that, you're going to yak. What's the story on lobelia?
So if you drink the tea, you will yak, meaning vomit. I think that or a yak comes out of you. Right?
Right. Vomit.
You some milk, and then you make some and butter tea with it. So no, lobelia is much safer than it's presented to be in the literature. Lobelia is an asthma herb. It is amazing for asthma when it works, and it works pretty reliably. Lobelia fits into what I call gateway herbs. And for me, a gateway herb is an herb where people who are very skeptical like myself, and you give it to people and you get an immediate result. Like all of a sudden they start breathing better. But lobelia sometimes helps people that are spacey, or helps other herbs work a little bit stronger. So if you're giving somebody some tulsi and rose, you want to add an adjunct or an augmenting herb, then something like lobelia. But no, you have to. I've never seen anybody vomit from tincture, and I give a lot of it. It's very acrid. It'll burn the back of your throat. It makes people vomit. But I've passed it around in groups of people, and people stop because it burns their throat. But I haven't seen people, so we've done vomit circles unsuccessfully.
Well, that's funny. Anything else that you see in the first aid camps that strikes you as maybe something that, moms could do at home with their kids, or any of the listeners, something pops up at home, or that they can be able to self-treat?
Well, you live around a bunch of medicinal plants, but one medicinal plant that's not threatened in any way is the plant called chaparral.
My favorite. Okay, and I saw your really long blog post on it. I was going to actually ask you about it because it's amazing.
So chaparral is great because it's also non-threatened ecologically. I mean, it's really non-threatened.
It's everywhere here.
It's everywhere. Well, one of the reasons it's everywhere is the plant is allelopathic. Excuse me, I'm going to drink a little water. Allelopathic gets me all fluttery. So it's not the word allopathic, it's the word allelopathic. And allelopathic means it puts out chemicals to prevent other plants growing near it. That's why when you go to chaparral, often there's only a few other species of plants, and the plants themselves are spaced apart because it also inhibits their progeny from growing near them. So chaparral is allelopathic, which is really makes it very well established. But I would say, so chaparral is just a great wound wash. And so like if you're saying like something you can have at home, you can gather a bunch of chaparral, store it someplace, it stores great. And then if somebody gets bit by a dog or gets a really bad cut and looks infected, soak the body part in a very strong chaparral tea. So like a big handful of leaves to a gallon of water is a really strong tea. I don't use it that much internally. There are some times, but it's really awful tasting. I mean, it's not just bitter, it's gross, right? It's so...
I recently started using it, but there was a point where I had a toothache and my dog had a toothache. So I gathered some, and it seems to work amazing for, like, if you can stand just doing like a little mouth rinse with it, it seems to just nip it in the bud, any kind of thing in the mouth.
It makes sense. I mean, it's a really strong anti-infective. It's particularly a good antibacterial as opposed to antiviral. And most tooth infections are bacterial.
And then if you are listening and you're in some other part of the world, we have listeners in, I think, like 30 some countries. There's a website called mountainroseherbs.com where you can get big bags of it if you're not in the desert like I am.
And so can I use Mountain Rose to talk a little bit about the free clinic?
Absolutely. Please.
So the reason we make this jump is Mountain Rose Herbs has been incredibly supportive of my work in the free clinic, which I'd like to talk about. And also, if Mason, if you're listening, or any Mountain Rose people, thank you for the support. And also, if people want to buy herbs, first check to make sure local people don't have it. So support your local growers. And then also, Mountain Rose has been very supportive to lots and lots of people. But I feel particularly lucky to have many years of their support, just financially and just herb-wise. The clinic would be much harder to run for me. Not harder to run, it'd be harder for me as an herbalist to distribute free medicine. So the Ithaca Free Clinic we started having meetings about 14 years ago. I just went with one of the other founding, so I'm a founding member of it. And I just saw somebody else recently, and so we had fun talking about it because it wasn't that much fun. You know, when you're starting an organization, it's lots of competing thoughts. But it was great. It was different. Like there was a few more holistic-y minded people, a lot of conventional medical people, so I don't use the word allopathic, I use the word conventional. And because people who work in the emergency room just see what happens if nobody has help. They just always end up in the emergency room and don't need to be there if they had regular medical help at the free clinic. And it was really, I have to say, it was very grown up. And by that, I mean, like I've been to other organizations and people fight over lots of things and then it doesn't happen. And for all of us there, while we definitely had different trains of thought about how things should go, everybody had the same goal and was willing to drop stuff. So all of us compromised constantly. I guess that's what I mean by grown up. So it's constant compromising. So in the end, we had a free clinic. So we opened January 2006, I think. We've been open ever since. And it's amazing. We see thousands of people a year. I see about 200 people a year, anywhere between 150 and 350, depending on how often I'm there. I only work 4 hours a week during the school year. The free clinic it's open a bunch. It's hard to figure out the hours. It's open at least 8 hours for walk-ins a week. So 8 hours a week for walk-ins. And it's for underinsured or really uninsured people. But anybody can see me because no insurance covers herbalists, right?
Right.
So there's no medicines or lab tests at the free. We have a little blood test. We can do cholesterol and A1Cs. But besides that, we don't have any lab equipment. So people still have to go outside and spend like $60 to $80 to get, thyroid tests, liver panels, cardiac panels, all that stuff. But they don't have to, of course, all the time. And then I give out the herbal medicines for free. Wow. And so it's expensive. It's about $8,000 to $10,000 a year. It really depends. Like, how do you put a tag to it? I say $5 an ounce. That's my tag. Just a reasonable amount to put it there. The only reason I need a number is because the free clinic, in order to get funding, needs to say how much money the more you say that you put out, the more money you can possibly receive. Otherwise, I wouldn't have any number associated with it. And so I see people for an hour for the first visit. That's less important. The free clinic is fucking awesome. So you can edit that out or just leave that in.
No, we'll leave that in there.
It's in my life, it's been one of the best things I've been a part of. We help a lot of people, and it's a real model of conventional medical working alongside less conventional medical, or holistic working alongside conventional. I'm the director of holistic medicine, which doesn't really mean much. It's only occasionally do I have to give a talk. But I've been seeing people for years, and the patients have the choice. We recently started having a more collaborative approach for certain people with chronic healthcare problems. So often lots of diabetes, like everywhere, lots of chronic pain, mental health stuff, anxiety, depression, a lot of anxiety, cardiovascular health. And so there's a few of us that get together and go over patients and try to figure out like the best approach, which is usually multi-modality. But I'm thrilled to be a part of it.
Okay, so let's talk about your school, because I saw that you have two really amazing looking programs. Do you want to talk about the two different programs you have?
Sure, going from non-commercial to commercial. So I've run, it's called the Northeast School of Botanical Medicine. I started it around 92, and it's been kind of up and running, except when I take years off, since 94. And so a lot of what you said in the intro is important to me. So the school, I would say the school has two main focuses. One of them is critical mindedness in healthcare. So I think of myself as a healthcare practitioner first, and then an herbalist second. And so I want to establish that with other people. And so what that means is that when somebody comes to me with a snake bite or a bad infection, or my neighbor with a swollen head, my first thing is not what herbs do I give them, it's what do they need? Do they need medical? Do they need to get money? Do they need a ride? And so that's a healthcare practitioner state of mind. And then my primary form of medicine is going to be herbal medicine. So that's an important part. So the school is kind of divided into two parts. First, very technical plant identification. So if I go to Arizona, I use the Peebles flora, which is really terrible. Nothing personal, Arizona, but you have a terrible flora. So a flora is a book that has all the plants of an area, and it gives sets of questions to find it. So it's called the dichotomous key. So I go to Arizona, by the way, very regularly. And so I'm going to jump out and maybe jump in. So 4 years ago, while visiting my sister in Tucson, I saw the thing I've wanted to see since I've been 8 years old.
What's
Can you
that?
guess what it is?
The Grand Canyon.
Remember what I said what my first favorite science was?
Oh, yeah, reptiles.
A Gila monster. My whole life. So every morning I get up from visiting my sister and go to Saguaro West National and find, now I've seen two in the past 5 years.
Wow.
But actually one of my goals, also you see pictures of them all over my website and Facebook because I'm just so excited. I love, they're just beautiful and they're venomous.
Yeah.
They're the only venomous lizard in the US. But they're not that easy to get bit by. You have to stick your arm in their mouth.
I've never seen one before. I've always wanted to.
Yeah. So right around, no, it's June, April around in Saguaro, sometimes you'll see them because they are colorful.
They're gorgeous. They're beautiful.
They're beaded. That's the other name for them, beaded lizards. So I guess like the real thing is if you want to go to my school, so it's kind of divided: technical plant identification, how to gather plants ethically or at least reasonably environmentally conscious, how to make your own medicines. So there's that part of the school, plant orientation. And then there's the people part. And so how to treat, how different herbs work and different conditions. And then the class that's 3 days a week, there's one that's 1 week in the month and one that's 3 days a week. The 3 days a week class, you have to go to the Rainbow Gathering, which we do next week, because we practice. And it's an incredible practice there. We see about 800 people over 5 days.
Wow.
So some of them are pretty simple, small splinters, but some are pretty complex.
Wow.
So there's that. But here's the thing. If you're interested in my school, just realize who I am. I'm deeply skeptical. I'm political. So if you're a Ted Cruz person, I would just be a little bit wary about coming to my school. So mean-spirited politicians are not a part of my repertoire. So, but really just that, like I am a materialist. And I think that almost everything can be described in a material way. Science is a relatively new study. It's a couple hundred years old. And every week the advances are made. So it's not like I care all the time. If somebody's anxious, I don't think what neurotransmitters are interacting in a negative way. But I do think, I'm non-spiritual. It's really very straightforward. I believe that everything has an explanation in molecules, and that takes nothing away from beauty, right? That's the thing. I think sometimes people think that science-oriented people don't see beauty, but that is absolutely inaccurate. I would say most of the science people I hang out with, like, we'll look at a flower and count stamen and think that's amazing, or just like the beauty of life is, beauty doesn't need to be quantified.
Right.
But it would be important. Like if you came to school and you wanted to talk about having a relationship with plants, you could have a relationship with plants, permission first, of course. But if you had that, I'd be a poor school to go to. Many schools are much more spiritually oriented than mine, like every school.
Okay. One last thing, because I know we sort of like got near it and then we backed away, and I know we're running short on time, but you were talking about so many people coming to your free clinic having issues with anxiety. For listeners who have anxiety or panic attacks or such sort of, nervousness, is there anything you recommend?
There's a bunch of safe herbs. I would say yes. Like when you talk about snake bites, I get nervous recommending stuff, but for anxiety, there's lots. So if we could quickly separate anxiety into two situations. So there's many, like every person has their own anxiety. So, but we could say that some people are spacier and some people are over controlling. And so we have that, like some people are very list making and detail, and they can't relax because they're worried about the next thing that they have to do. And other people are very flighty and very spacey with their anxiety and have a hard time making any decisions. And it's hard to access any strain of thought. So I would say for the people who are have kind of over controlling anxiety, and you have contingency plans for your contingency plan for your contingency plan, I would say two herbs that can be very helpful are passion flower and blue vervain. They're non-sedative, and so they're great that way. If you want to add some sedative herbs in there, like if you just can't sleep because your mind is racing, I would add things like hops and valerian. If you're on the other side of it, where basically you're always anxious, but it's very unclear why, it's just a kind of an underlying feeling all the time, I would say, I've already mentioned these, but tulsi, some people call it sacred basil, tulsi for me. Rose, and rose glycerite is particularly nice. So rose and glycerin. Damiana, really nice. Often people associate it for some reason with something to help you get your libido on. It could be helpful for libido if you're anxious because it relaxes anxiety, but it's not a libido maker. It's just a relaxing herb. It's a really nice one. And Damiana tea could be very nice. You have to take the plant out of the water fast. If you let it steep in the water, it tastes terrible. But if you let it steep for just like a minute, it's a really nice. If you like the flavor, it's a strong flavor. And then wild oats on a daily basis. Wild oats tea is great. And wild oats is just oats. So for the kind of spacey anxious, I would suggest, again, tulsi, rose, damiana, and oats. And then there's many others. You have things like kava, which is nice for disinhibiting. So if you can't relax, you want something to just drop you down a notch or two, and you don't want to drink a shot of something, kava could be really nice for that. That's a good beginning list. I have a lot of them. They're common.
And then just in wrapping up, are there any words of wisdom or insights or things you've been thinking about recently, or something that you find yourself telling people quite often that you could share?
I'll need a moment on this. There are things that I say pretty frequently. Oh, wait, come here. Let me introduce my cat. You can at least see him. This is Pedro. Hi, Katie.
What's the name?
Pedro. He's an 18-year-old guy.
Oh, 18. Holy cow.
Yeah, he's really docile. Usually he would never let me do that. His age is me.
Cat.
So, what do I tell people frequently? I'm not really sure. I'm going to switch it just a little bit, but it's a question I ask a lot that really helps me as a practitioner.
Yes.
And it's this. So somebody will come in, and people have multiple health issues, right? So they'll come in with Lyme, or they'll come in with just general anxiety, or they have a lot of things going wrong. And so a really helpful question to help determine how to help somebody is this question. It's many ways I ask it, but I ask it very frequently. And it's, if I gave you an herbal medicine and it helped you, what would it help? And it really just tightens the whole thing up. And often what's weird is the person will say something like menstrual cramps, something that's never been mentioned. So again, I'll say something like, if I can give you something and it kind of magically helps you, what would change in your body? Like what's the significant change? And often it's people give me very direct answers to it. And it's very helpful to know how to go forward. So I would say that's a thing that I use a lot, because if people, it helps them also think, what do I really want changed? So I think that's
So we could all ask ourselves that question, right? The listeners.
I think it's a great question. Or if I could make a change in my life, what would be different, right? And then, would I feel more relaxed? Would I sleep better? Would I have less joint pain? Can I still eat all the foods I want to eat and have no side effects? The answer is no, sorry.
Not that easy.
I have a soda in my hand right now with a plate of French fries.
I love that. That's brilliant. One last little squeeze in at the tail end. Anything you can say for limes, or is that opening up a can of worms?
Well, I would say so the first thing is, you have to know that particularly some of the tests like the Western blot or the ELISA tests have a lot of false negatives. But more importantly, is you can not be tested positive for Lyme and still be symptomatic, and you may or may not have Lyme, but there's still treatments. So the fact that you may have negative tests doesn't take away from your symptoms. So if the person feels like they have Lyme and they have spaciness or difficulty with memory, maybe kind of excess emotion where before it felt more in check, joint pain, headaches, that unless you really want antibiotics or you need a positive diagnosis, you don't really need it. You can there are herbs for those symptoms. And because a lot of people want to be validated for it and they get negative, their tests keep coming out negative, but you don't need validation for Lyme, you need validation for symptoms. And so that helps relax you that you're not crazy. These things exist in your body, whether or not the tests show it or not. And then I would say there's some herbs like for cognitive dysfunction where memory is impaired, something that's a nice mixture, but you shouldn't use it if you're on blood thinners. So if you're on warfarin or Plavix, I would suggest not using it. And it would be ginkgo, gotu-kola, rosemary, and calamus. And it would be equal parts. So it would be equal parts ginkgo and gotu-kola, and then a half part rosemary and a fourth part calamus. And that's nice for cognitive dysfunction. For the joint pain, anti-inflammatories can really help. But there's other things. I think it's often the mental thing that's problematic for people. And this is if you feel like your memory's been really impaired. So that's a nice form. You could take the rosemary out of it really as well. Just ginkgo, gotu-kola, and calamus are a nice, helpful, increased cerebral perfusion without being too dramatic. But again, ginkgo is problematic with blood thinners because it also interferes with blood coagulation.
And any of those that you could take if you were pregnant?
I don't know if I would take it if somebody was pregnant.
Yeah.
You could probably gotu-kola would be the safest. I would have to check.
Mm-hmm.
None of them are very contraindicated.
Sure.
There's no none of them are uterine spasmolytics or spasmodics. None of them creates uterine spasms. Pregnancy is tricky because so many herbs are safe, but it's such an important event that it's hard to make overriding. I tend to work with midwives and just trust their judgment better than mine. But trust their judgment.
And so, okay, so that remedy you could use not just for Lyme's, but any sort of memory, cognitive. Somebody just finds they're not as sharp as they usually are.
Say if it's associated with any kind of TBI, traumatic brain injury, so car accidents. So this is a little bit better if, like a lot of people just don't have great memory, and then you don't need all these herbs. But if your memory's been impaired by either a long-term illness or an accident, then this might be helpful. And
if it's just the regular run-of-the-mill memory fail?
Well, that's just a part of being alive, I think.
Too bad.
You only store so much information. And a lot of people want better memories. I would say if you reduce anxiety, sometimes memory improves because it gives more room. But really, everybody wants better memories, but we're limited, and some people more than others. Some people, here's the answer. Don't compare yourself to people with great memories.
I love that. So down to earth and practical. Thank you so much, Seven Song, for being with us. Really appreciate your time. Such a joy to have you on the show.
Yeah, it's been very nice to meet you as well.
Thank you. Thank you so much for listening to the Flowerlounge Podcast. We now have listeners in 61 countries, and I just want to say that I am so grateful that you'd spend your time with us. I also want to take a second to give a shout out to LOTUSWEI, who makes this podcast possible. We recently released a new flower essence blend that has been a game changer for us. In fact, it's called Game Changer, and it's a combination of the most powerful flower essences for being totally present. Because if you, like me, you might have experienced on occasion having a really big to-do list, a little overwhelming, feeling constantly on the go, and the sense that time is flying by. Like, where did last week go? You may want to check out the Game Changer. It makes you feel like you have all the time in the world. You can take breaks without feeling guilty like you should be doing something else. You feel crystal clear with the ability to make decisions really effortlessly. And things that seem kind of heavy or a pain in the butt on your to-do list to do before now just seem like super easy. So if you have gotten any value out of listening to the podcast, we'd love your support. We're currently under contract to buy a new building where we'll be able to open a store, have an education center, offer botanical treatments and flower elixir happy hours, and have a cool new podcasting space that will be a major upgrade from where we are now. So at that time in the fall, when we move into our new space, we will have had a year of podcasting under our belt, and we'll be starting up a whole new format that you're going to love that will be even more engaging and interactive. So again, thank you so much for your support, for listening, and for spending time with us. We really appreciate it. Thank you so much for listening to the Flower Lounge. I'm Katie Hess, and we'll be releasing a new podcast every Wednesday. If you like what you heard, or you know someone who might be touched by our conversation, share it with them. And don't forget to subscribe. To find out what your favorite flowers mean about you, take the quiz at lotuswei.com.